I'm Carmela Castellano Garcia, President and CEO of the California Primary Care Association. It is my pleasure to welcome you to this year's conference, and I hope you're all as excited as I am about this conference. We have an amazing event planned for you, but even more exciting, this year, CPCA is celebrating our 20th anniversary. It's amazing. 2 decades of leading community clinics and health centers in this state. What a milestone. What an accomplishment. And something definitely worth celebrating. And let me tell you, we intend to celebrate. As president and CEO of CPCA for the past 17 years, I have been fortunate to see the growth and evolution of both CPCA and community clinics and health centers firsthand. I am proud to say that we have been able to achieve great things over the past 2 decades by working together, united in a common goal of achieving our shared destiny. The shared destiny of community clinics and health centers has been to become leaders in primary care delivery in the state and the model of care well into the future. And that future starts today. And CPCA has come a long way over the past 20 years, growing from just 3 employees to nearly 40. And our community clinics and health centers have experienced similar tremendous growth and success. In fact, the number of patients served by California's clinics and health centers has more than doubled in the last 20 years, delivering care and value to nearly 5.5 million patients last year. California is home to more than 1,000 community clinics and health centers throughout the state, serving a wide variety of residents and meeting a range of healthcare needs. On top of that, each year California's community clinics and health centers stimulate more than $3 billion in total economic impact and support approximately 27,000 jobs statewide. Truly amazing impact. And over the last 2 decades, community clinics and health centers have evolved from a grassroots movement to become a provider of choice in the era of healthcare reform. Now, we were most certainly the provider of choice to Congress, which singled out community health centers as a central model of care by making an $11 billion investment in our growth and expansion through the Affordable Care Act. Over $1 billion of those dollars has already come to California. And let me tell you, that investment has certainly paid off. Not only is California leading the nation in healthcare reform, implementation, and enrollment, but California's community health centers are leading the nation. This federal investment, for example, the outreach investment, $25 million in outreach and enrollment dollars has come to our state, and that's helped to really catapult California to #1 in this country in terms of expanding coverage. It represents a sound ACA investment that has reaped tremendous results. With these precious resources, our health centers were able to hire and train 2,000 certified enrollment counselors. They've helped to assist hundreds of thousands of Californians into coverage. In fact, CECs from community health centers accounted for more than half of both covered California and Medi-Cal assisted enrollments. And in the Medi-Cal program, health centers accounted for nearly 70% of all assisted enrollments. And community clinics and health centers have occupied 7 of the top 10 enrollment entities for covered California. That's amazing, and congratulations to all of you on a job well done. Absolutely. Another part of this federal investment, $200 million has come to our state in capital development grants, which have helped build new, beautiful, state-of-the-art facilities throughout our state. In fact, I had the fortunate circumstance just in the last few weeks to visit one of these new health centers. I was invited to speak at the CommuniCare Board of Directors as part of a strategic planning process. This meeting was at their new facility, the Hanson Family Health Center in nearby Woodland. This amazing, new, beautiful, state-of-the-art facility has medical, dental, mental health, all under one roof, bringing much-needed services to this local community. A $5 million grant leveraged $4 million in other resources from the community, resulting in only a $1 million mortgage for this amazing facility. And it literally took my breath away when I arrived. It's just one example of the success of more than 80 grants that have come to our state for capital expansion. These results are truly astounding. And in terms of new access point funding or creating new federally qualified health centers in the state of California, we have received so far $55 million. And this has resulted in a whopping 92 new community health centers since the passage of the Affordable Care Act. That's 17% of all new access point funding has come to the state of California. This really shows the tremendous need that our state has, but it also shows how competitive our health centers are at the national level, because don't forget, these dollars are absolutely very competitive. But our success under the ACA, and we all know this, it didn't happen overnight. Over the past 20 years, we at CPCA, together with our members, have focused on building our advocacy capacity to ensure that our community health centers' interests are effectively represented in our state capital, and to ensure that our national partner, the National Association of Community Health Centers in DC, has a strong partner in the West. Within the last 2 decades, CPCA has sponsored or co-sponsored 49 pieces of legislation. Of those, 29 have been signed into law by our governors. That's an amazing track record. And some memorable legislative victories include implementation of the prospective payment system model here in California, one of the best in the country. The Cedillo-Alarcon Community Clinic Investment Act of 2000, I know many of you remember fondly, a $50 million investment in health centers which leveraged millions more. And the creation of the Steve Thompson Loan Repayment Fund, which has helped bring many doctors and dentists to community clinics and health centers in underserved areas. These are just some examples of the legislative victories of this association. And we have had some monumental community clinic champions over the years who have embraced our mission and our values to provide health care to all Californians. Champions such as Senator Gil Cedillo, Senator Pro Tem Steinberg, Assemblymember West Chesbrough, of course, Congressman Waxman, leaders who believed in our cause, believed in our model, and appreciated the access that we provide to their constituents and their communities throughout California. And they've gone to bat for us in the legislature and in Congress. But much of that is because of you, our members. It is your relationships that you have built with legislators in your local communities, as well as the role you play on the ground in your health centers, providing high-quality, cost-effective care to those in your communities. It does not go unrecognized. You are valued and appreciated. Our Day at the Capitol event continues to grow, with 2014 being the largest delegation. More than 300 members, staff, and I'm proud to say students and physicians met with legislators to discuss the important issues that are affecting us as part of our annual event. And California continues to host the largest delegation in DC at the National Association's Policy Issue Forum each year. This is a true testament to community clinics and health centers, the role you play in our advocacy efforts here in the state and at the federal level. And this is the large part to why we have been so successful over the past 20 years. And certainly with the Affordable Care Act, because of your involvement, your ability to come together for a common cause, your ability to mobilize when needed. I think you all deserve a round of applause for the tremendous work you have done for this association, for all health centers throughout the state. It's truly appreciated. And together, we've certainly made great strides. But part of looking back and celebrating our past is learning from our past experiences and improving on them for the future. And 2014 not only marks the celebration of this past and 2 decades of work and accomplishment, but it also marks a historic moment which we will all look back on as monumental. And that is the first year of expanded coverage for millions in California through the implementation of the Affordable Care Act. Now, for those of you out there, I think it's probably everyone in this room, who've dedicated your professional lives to advocating for the rights of the uninsured, the passage of the Affordable Care Act is really a dream come true. I know for me, that's how it feels. It is the first and important step in the true ultimate goal of providing coverage and access to care for everyone. And it is the shared destiny of all community clinics and health centers to help fulfill this dream. And that's why we've entitled this year's conference, A Shared Destiny. Because I truly believe we spent the past 20 years getting to this moment, a moment that has positioned community clinics and health centers as a leader in primary care delivery, as the model of care delivery well into the future. You know, but admittedly, we still have a lot of work to do in getting there. Achieving our shared destiny will certainly be energizing and demanding at the same time. The implementation of the Affordable Care Act and achieving the overall goals of the triple aim to improve population health, to improve patient experience, and lower costs, this has changed the way the healthcare system works, and it's changing how community clinics and health centers must operate within the larger system. The advancements made in the past 3 years due to the Affordable Care Act have been significant. Many of you are dealing with providing quality care to some of the most complex patients in our system, while ensuring positive patient outcomes and also by improving costs to the larger healthcare system. We need to make sure those costs decrease, and we are playing that role. But it's challenging. Those of you in rural areas are taking on managed care for the first time. You're all boldly taking on these challenges while millions of newly enrolled patients are entering the system. Many of them are now covered through Medi-Cal, and many of them are selecting your community health center as their preferred provider. And this places even greater pressure on each of you to perform efficiently and deliver effectively. And that's why at CPCA, we continue to be forward-thinking and develop initiatives and programs and services that are going to help each of you in achieving our shared destiny. Community clinics and health centers, we need to maximize all the tremendous opportunities that are available to us under healthcare reform and ensure that we are working strategically and effectively within this new system. We are working hard to move all health centers forward in a way that will take us to a new level. And we believe there are 3 central areas where we need to focus on to help evolve community health centers in the broader, larger landscape. And that's health system transformation, health center transformation, and California Health Plus. In terms of health center transformation, because healthcare reform is changing how care is delivered and financed, community clinics and health centers need to be at the forefront. We need to be the driver of this change. We're going to be playing a central role, and we are playing a central role in care delivery for millions of Californians, but we need to work more cohesively with others in the healthcare system to further encourage cohesive patient care. We cannot afford to be isolated entities working in silos. We need to work together and integrate care for our patients. Working with the system in an integrated and more dynamic way will make us more involved in the larger healthcare landscape, allow us to provide better care to the patients that we serve, and in the end, have the biggest impact on overall costs to the healthcare system. And nowhere are these ideas, the ideas of driving reform and working together in partnership, nowhere are they coming together more strategically than in the work that CPCA is doing and leading in the area of payment reform. We already know from the Value of Community Health Centers study published by CPCA in January of 2013 that our health centers are proven to bring down total cost to the healthcare system. We have demonstrated that with the care we provide now. But just think of the cost savings there could be to the system if community health centers were able to see patients in new, innovative, technologically advanced ways, and with flexibility, not being tied to the visit-driven payment system. Well, CPCA and our members are working to do just that. Working with John Snow Incorporated, we've developed a payment model that will ensure that there is sufficient flexibility and primary care resources for community health centers to be able to continue caring for the most vulnerable patients. This model will incentivize and reward health centers for achieving high-quality care. Fundamental to this model is transforming the base payment that health centers receive and allowing them the flexibility to care for patients in the right way, the right time, and at the right place. That might mean phone or email consultations, home visits, same-day appointments for mental health and primary care. This alternative payment methodology will make it easier for primary care providers to integrate other services like behavioral and mental health. But most importantly, this payment model guarantees that health centers will be paid what they would have received under PPS, and participation in these pilots is purely voluntary. I would like to applaud the members in this room that have stepped up to play a leadership role in our pilot program. These leaders will help define a new value-based model that we may all be working under in the years to come. And we appreciate the time and the energy that our pilot sites are willing to invest to work on this project over the next few years and develop a program that may change the way health centers are financed with national implications. And we anticipate that this change will be for the better. That is why we are driving this initiative. We are wanting to make a better payment model for California. So please give a round of applause for the 70 health centers who are stepping up to be Phase 1 pilots for this historic program. We really appreciate your leadership. And through our partnership with the California Association of Public Hospitals, half of these sites are public hospital FQHCs. And we cannot succeed in this monumental effort without partners. Along with the California Association of Public Hospitals, the California Department of Healthcare Services is a key partner in this endeavor. The California Association of Health Plans, the local initiative plans of California, and their members are key, necessary, and essential partners. This is really an amazing opportunity to innovate our overall system in partnership with others, the wave of the future. And we are working to help our members get ready for the first phase of this payment reform work. We know it's going to require health center transformation. We understand that readiness is critical and is going to play a huge role in the success of the pilots and in the overall success of payment reform in California. We have a new program we're developing, the Capitation Payment Preparedness Program, or CP3. Keep your ear out for this one. It's going to facilitate the transformation of how health centers operate and provide care to ensure that you can effectively manage your patients in a managed care environment with capitation, to have effective communication and data flow with managed care plans, to achieve statewide aggregated data with the long-term goal of lowering the overall cost to the system while improving patient care. So we intend to work with our CFOs and give them the tools that we need that you can have to sustain your operation in a capitated environment, to demonstrate value to the system overall. We need to work with our providers and our care teams. They're going to need training on how to see patients outside the fee-for-service context and the team-based care, how to maximize that incredible model. And we're going to work with partners to develop these tools and programs and the related training and technical assistance to transform health centers within this new environment. So the progress made through this readiness program, through payment reform, through our transformation work, working together is going to be instrumental in ensuring that community clinics and health centers will be able to carry out their mission to provide high-quality care that's going to produce health outcomes outlined in the Triple Aim. But health centers, through this, must also remain viable, desirable, and fiscally sound through this tremendous transition. We know that this is challenging. I've heard from many of our members that implementing your electronic health systems has been difficult and time-consuming, and it's impacted your bottom line. I've heard more and more health centers talking proactively about mergers. Yes, I said it, mergers. I hear you. I know it's a time of great transition, and for some of you, it's been harder than for others. We know from the Capital Link report, financial and operational profile of community clinics and health centers, many of you are operating on thin margins. Even those that manage to stay consistently in the black need help to find ways to remain on steady ground. If we want our health centers to reach that goal of value-based care, we need to ensure that they have the resources necessary to get there, which is why CPCA will continue to find partners and develop service lines that will help our members get into stable positions. For some, this may mean partnering with other health centers to share resources in order to be able to remain open and serving their communities. For others, this might mean looking at streamlining your billing and collections using services such as our Patient Revenue Cycle Management Program. CPCA is looking to develop services tailored to the needs of our membership. And we also know that patient experience will play a huge role in the continued viability of health centers. We know from the Langer research studies on patient satisfaction the way our current patients feel about care from community clinics and health centers. And we've done our own focus groups throughout the state of California with our current patients. And you know what we found out? Our patients mainly feel positive and grateful for the incredible care they receive from you. But we also know that those who are not our patients still wonder if the clinic down the street is where they want to get their care. So we know that we have work to do to improve on patient experience across the board. And this research has played an important role in the development of our own strategic plan and our strategies to help health centers transform. But it's also influenced the branding work that has been under development and rollout at our association over the last 3 years. The work we are currently doing with California Health Plus. We're operating in a new, more competitive marketplace. Community clinics and health centers are competing for newly covered patients, as well as hanging on to our current patients. They now have coverage. They now have a choice in provider. But we know that branding and marketing are essential components to educating our patients about the unique services, the high-quality services that we can provide that are unique from all other providers. And that's the basis of an effective outreach and enrollment strategy, educating our patients to better understand what community clinics and health centers are, what makes them unique, and the provider of choice under the Affordable Care Act. And that's California Health Plus, our statewide brand for community health centers. This represents a bold movement forward in healthcare in the state's community health center system. Because joining together, we are leading the way for healthcare delivery in this era of transformation. Many of you in this room are using the California Health Plus brand to distinguish yourselves as top quality service providers dedicated to working together to meet California's healthcare needs. As I mentioned earlier, community health centers were originally conceived out of a grassroots movement to provide care to all, grounded in helping those in need. California Health Plus is the next phase of the community health center movement. The Affordable Care Act has positioned health centers as central to the system of care. The ACA has positioned community health centers to be the provider of choice in the new healthcare landscape, the model of care for everyone in the system, in California and nationwide. California Health Plus, this network will be a major player in this new competitive marketplace. I commend those health centers that have joined the brand, and I encourage all of you to get on board soon. We are in the midst of great change, both to the healthcare system and to health centers. This time of transformation will be challenging, more for some than for others, but we have set forth an ambitious strategy for meeting our goals and achieving the triple aim. And I know that we can do this. I know, because I know what we can accomplish when we come together for a purpose. We have a 20-year track record that proves what we are capable of, and I am very optimistic about our future. From where I'm sitting, our future looks very bright. And if I've learned anything from being here with you as your CEO over the past 17 years, what I have learned about health centers is you can count on us. Even when things seem daunting, even when our battle seems uphill, we will prevail. Working together, we will come out on the other side of this better than we were even before, for our patients and for our communities. Community health center leaders are some of the strongest and most resilient people I have ever worked with. You're all incredible leaders. You have extraordinary staff who are doing amazing things each and every day in your communities. You've already positioned community clinics and health centers as leaders in healthcare reform. It's through your tremendous work in outreach and enrollment, and we can continue to have a positive impact through the rest of the healthcare reform implementation in California. Of that, I am absolutely certain. And as this state continues to lead the nation in healthcare reform, our community health centers will continue to lead the system in transforming care delivery. We are gradually and deliberately working toward being that provider of choice for millions of newly insured Californians, setting the stage for others throughout the nation. Because that is truly our destiny. Together, a shared vision of the future. I can see it, and I think you all can too, because this is our future. It's our rightful place. It's ours for the taking. And so as we move forward in the shared destiny, I will hope you will join me in celebrating all that we have accomplished. And we so much look forward to seeing what more we can do collectively, unified in vision and purpose. It has truly been my honor and pleasure to have been with you over these last 2 decades, and I look forward to many more years together. Thank you so much.